Hello everyone, I'm Johnny, and today we're talking about World War II flight nurses and Reba Whittle. During World War II, female Army nurses had dangerous jobs, both in the Pacific and European theaters. When the Allies landed in Europe to liberate the continent, hundreds of nurses traveled directly behind frontline units, which put them in range of German artillery. Being captured was a real possibility as well. All American nurses during the war were officers, the idea being if they were captured, they'd be treated better by the enemy. The most dangerous nursing position was likely the flight nurse. Flight nurses often flew without the protection of the Red Cross marking, because their C-47 transport aircraft also flew military supplies. They were subject to anti-aircraft fire, and often traveled right next to the front lines to evacuate the wounded. Several of these planes crashed during World War II, and 17 flight nurses were killed in total during the war. Flight nurses had to learn survival craft and be experts at emergency medicine. The flight nurse was often the senior medical officer on a flight and commanded over a male surgical technician. These flights transported up to 18 injured men on specialized C-47s. One of these nurses, Reba Whittle, had an especially unique experience during World War II. She was the only American female prisoner of war in the European theater during World War II. Whittle first studied nursing in San Antonio, Texas, and became an Army nurse in 1941. She was well educated and graduated top of her class. In 1943, she graduated from the Army Air Force School of Air Evacuation. By mid-1944, she became a seasoned flight nurse with the 813th Medical Air Evacuation Transport Squadron, flying over 40 missions and logging over 500 hours flight time. On September 27, 1944, Whittle left England on a C-47. She was on a mission to collect casualties from a makeshift airfield close to the front in Belgium. Because the aircraft Whittle was flying in was used frequently for medical and military purposes, it was not marked by a Red Cross. The aircraft flew off course and was hit by German flak and crashed 4 kilometers outside the German-occupied city of Aachen. The crash killed one of the pilots, and Whittle suffered from a concussion and lacerations. She and the crew were quickly captured and taken to a nearby village and treated for their injuries, after which they were driven to a hospital nearby, where Whittle saw a German doctor. She was well taken care of, and her story is a story that both highlights the bravery of flight nurses and is a good reminder of humanity in Germany during the war. Whittle was separated from the rest of her crew, who were taken to the main Luftwaffe interrogation center north of Frankfurt. Whittle was lodged at the nearby hospital, where her skills could be put to use providing aid to wounded prisoners. She was transported to 2 other POW hospitals where she was eventually able to put her skills to work, treating burn patients at the Rehabilitation Center for Amputees. After several weeks, she was seen by representatives of the International Committee of the Red Cross that did have a relationship with German POW camps. The Germans felt it was more trouble than it was worth housing this one single female POW, so they were more than happy to negotiate her return. In January of 1945, she headed to Switzerland by train and began her return to the United States, along with other released POWs returning on medical or psychiatric grounds. She would receive the Purple Heart for her injuries and the Air Medal for meritorious achievement while participating in aerial flights in unarmed and unarmored aircraft. She further received a telegram from Franklin D. Roosevelt thanking her for her service. She continued work as a nurse stateside, but remained grounded due to persistent headaches. Post-war, she married and had 2 sons. She struggled with anxiety and pain after the war, receiving some compensation from Veteran Affairs, known as the Veterans Administration at the time. Only in 1983, 2 years after sadly dying from cancer, did the Department of Defense give Whittle official prisoner of war status, and in 1997 she was posthumously awarded the Prisoner of War Medal, as many Army and Navy nurses who were captured by the Japanese had received. Alright, I'm Johnny, thank you for watching, and a big thank you to all the nurses out there, both in scrubs or military uniforms, who are out there serving humanity every day. Take care, and we'll see you next time.